Hi, my name is Callie Hatch, and this will be my full head-to-toe assessment practice. I'm going to use my husband as my patient, and please excuse us. We've been sick for the last 2 days, so please excuse us if we're kind of not 100% here. So I'm going to walk into the room. I'm going to identify my patient. He is a 52-year-old male, and I'm going to ask him to confirm his name and date of birth before I start talking to him. Hi, my name is Callie. I'm going to be your nurse for today. Can I confirm your name and date of birth, please?
J. Encinas, 5774.
Okay. So today what we're going to do is just do a head-to-toe assessment of you and make sure that everything's checking out, everything's okay. Is that okay with you?
Okay.
So I get consent from the patient. I want to make sure that I know anything of when I'm walking up, so I can see if the patient is jaundiced, I can see if he's pale, I can see if he's breathing heavy, I can see his demeanor, if he looks lethargic, if he's got his eyes closed and not responding to me, things of that nature. So right away in my first presentation, I'm looking at all these factors. I would also know that the scene was safe before I even entered in. So his skin color at this time mixed normal. He doesn't look disheveled. He looks well groomed. He's got all his teeth. He's answering appropriately. He was able to tell me his name and date of birth, which helps with my orientation questions. So all that's being noted as I'm speaking with the patient. So I've also not able when they're in bed to look at the gait, but I would also, if they walked in, observe their gait and how they're walking. He's also not malnourished. He's not underweight. He looks a normal, healthy weight for his age and his size, and his behavior is appropriate. So first I'm going to start with the head, and I'm going to look from the top to the bottom, and I'm going to assess things as I'm going down. I'm not going to go by section to section because I feel like you're going back up and down, back up and down. So first I'm going to palpate the head. I'm going to see if there's any contusions, any swelling, any pain when I'm touching it. I'm going to see if there's any weird patches where hair's missing, anything of that nature. I'm going to make sure that there's no lesions, scars, anything like that. Then I'm going to go ahead and I'm going to come down to the face. I like to start with the eyes because that's a neurological and it kind of tells me where the patient's at as well. So we have these cool little lights on our badges at work. So I'm going to have the patient actually take their glasses off to help me. I'm going to look at your eyes and see how reactive they are. So you're going to see a light shine to your eyes. So just look forward at me and I'm just going to see them reactive. So I come in, they're active. I'm also going to have you follow my pen. I'm going to have you come in. Okay, he's acclimating to and following the pen appropriately. Okay. I'm also going to test your peripheral vision, so I'm going to have you cover one eye at a time, and then we're just going to check. Tell me when you see my fingers come into motion. No, look forward, not at the fingers.
Mm-hmm.
Okay. And switch eyes, please.
Mm-hmm. Mm-hmm.
Look forward, please. Forward, please.
Mm-hmm.
Okay. Go ahead and take your hands off. Raise your eyebrows for me. Up and squint down. Okay. And do you see the same out of this eye as you do that eye? No blurred vision or anything like that?
Mm-hmm.
Okay. Can you also smile for me? I'm looking at the symmetry of the face at this time. I'm looking at the symmetry of the eyes. He's got even amount of teeth showing on each side. Can you stick out your tongue and move it from side to side? Side to side, thank you. His ears are even at this time. I'm gonna look at the ears for any excess wax, any lesions, any deformities, where they're set in relevation to, or in relatively to the eyes, to make sure that they're okay. You can also feel the pulses here. And then I'm gonna go ahead and look in the nares. There's no bleeding, there's no lesions, normal hair in the nostrils. He does have a little bit of crookedness that we have documented from a previous trauma. And then I'm gonna go down to the neck. So I'm gonna go ahead and I'm gonna feel the lymph nodes. At the same time I'm feeling the lymph nodes in the neck, there are volatile areas in the neck. I'm also gonna be looking at the front to make sure there's no deviation, make sure there's no goiters on his thyroid, anything of that nature. I am also going to make sure he can swallow okay. Any issues swallowing? Any pain with that?
Nope.
Can you open your mouth and just go, ah? Looking at the back of the throat, there's no deviation. The uvula is in the center. There's no swelling or differentiations in color. There's no yellow coating or white coating on the tongue. There's no lesions in the mouth, no missing teeth. So now that I've done the neck, I'm gonna have him do range of motion of the neck. So go ahead and turn your neck to that side. Thank you. And can you do it to the other side? There's also no JVD notice as well. Then I'm gonna come down the shoulders. Can you shrug your shoulders up for me? Thank you. And then I'm gonna also look on the chest. I'm not gonna expose him for the video, but I will be looking on the chest again for any scarring, any unequal rise and fall of the chest. I'm gonna be looking at if he's using any accessory muscles when he's breathing. I'm gonna look at just any concaveness of the chest, any like pointing out of the chest, any deformities of the chest. I'm also gonna look for flail chest. I'm gonna look to see if the rib cages are equally going in and out, if he has the pigeon chest, or like the CHFers have that chest that's sticking out, the barrel chest of the CHFers. I'm also going to listen to the lung sounds. So I'm going to listen to them in the front and the back. So I'm going to go ahead and listen here. Just take another breath in, take your time, don't try to breathe too fast. At this time, I could also listen for heart sounds and apical pulse. Are you having any chest pain at this time?
No.
All right, I can listen to the apical pulse. And I can also listen to bowel sounds here. A lot of times you can hear them while you're listening to the chest. So I'm gonna listen for about a minute in each quadrant, making sure I hear bowel sounds and noting if they're active or hypoactive, hyperactive, etc. So I would listen to the apical for 1 minute. I can also listen to the sides to also listen for a pleural rub. Okay, so while I'm here, before I set the patient up, I'm gonna have him hold his hands out in front of him. Can you hold your hands up, close your eyes? I'm gonna look for a drift on the patient. All right, can you open your eyes? Can you push up for me? And can you push down for me? Can you squeeze my fingers? Pull towards you and push away. Okay, perfect. I'm also gonna check apical pulse, peripheral pulses bilaterally, just to make sure that they're equal. If there was a child, I would do it in the brachial area. I don't know if I keep doing that. And at this time, I can go ahead and listen to the tone of the abdomen, and I can also then palpate and see, does it hurt? He just recently had surgery, so I'm not doing a full pressing on him in the video, so I apologize. So there's no pain or any rigidness, tenderness. We can do, any bloating, distension, things of that nature. Now I'm going to actually have you sit up, sir, and I'm going to listen to the back of your lungs. I'm also going to look down the spine to see if there's any deviations in the neck and the spine. So I'm listening to the lungs. Just breathe normal, don't breathe too fast, just so it's comfortable. This would preferably be done with the shirt off, but again, like I said, I wasn't going to take the shirt off for the video. And I would do the 6 locations on the back. I'm also going to check the spine for any tenderness, any tension, any deformity in the spine. And I don't feel any deformities. Okay, did any of that hurt when I was pressing on that? We're going to look also for any scars or things of that nature. Go ahead and lay back. I'm also going to now auscultate the hips, see if there's any pain in the hips. Okay, in the hips. Okay, can you raise your leg up for me? And hold it. All right, and back down. And the other one. Okay, go back down. I can also tips for the pulses behind the knee. The pulses behind the knee here. And I'm gonna have the patient push up on his feet, not like towards me, your feet towards me, okay, and down like a pushing the pedal. push pedal. Next time I'm also doing cap refill. Cap refill was okay in the hands as well. And the color and the temperature is warm. They're warm to touch, and cap refill is immediate. Okay. I can also check for the pulses in the feet, on the top of the feet here, and then right behind the ankle bone here on both feet. And you would do those, when you do the pulses, you're gonna be giving the strength of those. Sometimes it's only Doppler if they have poor circulation in their feet, so I would state it's by Doppler only. So that's all I would do for that. Then I'm gonna have the patient sit up. Can you face me real quick? All right, I'm gonna go ahead and have you push up with your knee, up. Okay, thank you, and up. And then I could test reflexes. I could also test hearing at this time, where I whisper something in the ear. I could test smells. I can also test to see if he's reactive to stimuli, so I can do soft stimuli, see if there's any deviation. Do you feel that the same on each side? You feel that the same on each side? Okay, I could also have him close his eyes and ask him where I'm touching. Which leg am I touching?
Left leg.
Okay, and which leg am I touching?
Right leg.
So that would also be if there's any loss of sensation. Then I could also do painful, which I'm not gonna do, but I did have a patient the other day that had total neglect on one side, and we had to actually do painful. He still didn't feel it. He could feel the pressure, but couldn't feel, he was not even looking at us. So that's another thing you can see if they're looking at you. So I can test reflexes. I can now have the patient stand up. I can test balance, go on one foot and the other. Okay, go ahead, and I'm gonna have him walk across the room for me. I'm gonna look at his gait, see how he's walking, come back. Go ahead and sit down. Obviously you can do this with a patient who's not ambulatory. So those are some of the tests to see, like balance, his gait, his ambulation, things of that nature. And then I'm gonna go ahead and I could do a vision test with him as well if I needed to. And I would conclude by asking the patient all the safety questions, asking them if there's anything that they have complaints of, anything that's hurting them, and get a full extended history as well during that time. And that's it for me. Thank you.